Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Are you ready to learn a tremendous amount about your bones, what can be causing bone loss, as well as things you can do to really improve your bone health? Well, you're in for a real treat because we have a very special guest today, and that's Dr. Felice Gersh. And Dr. Gersh is a multi-award-winning physician holding board certifications in both OBGYN and in integrative medicine. Her educational background includes an undergraduate degree from Princeton University, a medical degree from the University of Southern California School of Medicine, OBGYN residency training in Kaiser Hospital in Los Angeles, certification in environmental medicine, and graduation from the 2-year fellowship in integrative medicine at the University of Arizona School of Medicine. Dr. Gersh is a renowned speaker presenting innovative lectures across the United States and internationally. Her first book, PCOS SOS, A Gynecologist's Lifeline to Naturally Restore Your Rhythms, Hormones, and Happiness, is an Amazon #1 bestseller. And her second book, PCOS SOS, Fertility Fast Track, was published recently. Dr. Gersh's distinguished career includes several academic affiliations. She currently serves as consultative faculty with the University of Arizona School of Medicine's Fellowship in Integrative Medicine. Dr. Gersh has been the recipient of numerous awards, membership in the Alpha Omega Alpha, the Medical Honor Society, named Outstanding Attending Faculty for the OBGYN Department at USC, the Keck School of Medicine, and recognized as the Physician of Excellence for Orange County 16 years in a row, and awarded status as a SuperDoctor of Southern California for the past few years. Dr. Gersh is also the medical director of the Integrative Medical Group of Irvine, leading her team in the treatment of women of all stages of life. And I've known Dr. Gersh for several years, and she has so much information on osteoporosis, and she's worked with this for so many years that she's just a wealth of knowledge. And it's taken us a few years to get this interview together. So I'm really excited. And in our interview today, we really delve into some things that just aren't in conventional treatment and what really can make a difference in your bones and what you can do about it. So there's lots of juicy information, so stay tuned. Welcome, Dr. Gersh. I'm just thrilled to be here with you today.
And I'm so thrilled to also be here with you. This is such a wonderful podcast that you have, and I'm so excited to join you today.
Well, thank you so much. You know, I have to tell you, you're one of the reasons I started this podcast, because you have such an amazing background, not only in gynecology, but in integrative medicine. And you put the two together, and this is not information that people know. And that was the reason I started this podcast, so that we could get this important information out to people because it is so helpful. So thank you so much for being here, and I can't wait to get started. So let's begin. First of all, most people, let's just start at the very basics, because most people think that they don't have to worry about their bones or even think about their bones until they're older. It's something that happens when people age. But that's so far from the truth. And can you just tell everyone why that's the case?
Well, it's kind of like saving for retirement. You know, you can't start worrying about how much you're going to have to live off of in your retirement years, like the day before you retire. And your bones have to be developed, grown, and nurtured throughout the bone growing years, which are primarily from the onset of puberty through the early 30s. And you don't really get another chance. You don't get a second redo. So you have to have really robust, healthy, strong bones by the time you hit 35, or you're not going to have that really great storage of healthy bone for the rest of your life to like work off of. So you have to start worrying about bone really from the very beginning of your life. And in fact, there's now data that you have no control over, that the environment that you're in utero actually has an impact on your bones as well. But since we can't control what happened with our moms when we were in utero, we have to control from the moment we actually recognize that we have choices, and then we have to make the right choices.
Oh, I love that. And there's actually a statistic that you had said in one of your talks that I love, that by increasing peak bone mass in childhood by just 10%, that could delay development of osteoporosis 13 years. That stuck with me because that's incredible. It's just not something, and it's interesting because I'm a member of the New Jersey Interagency Council on Osteoporosis, and I'm the physical therapy representative. And what is our goal this year? To reach pediatricians and primary care physicians so that we can get these people young, young children, and just bring osteoporosis into the awareness, because it can make such a huge difference. So everybody that's listening, listen for yourself, but also take this information for your children, your grandchildren, because that's where it starts. And we can really have such a difference if we start early on. So what do you see? What do you see? You're a gynecologist and you're also board certified in integrative medicine. And that combination is amazing to me. But what do you see that's missing today so often when people see their doctors in traditional medical, basically conventional medicine treatment of osteoporosis?
Well, in terms of the treatment, of course, by the time someone has full-blown osteoporosis, we do have some limitations as to what we can do. But even there, what's not understood is the true importance of estrogen. It's poor estrogen. As you know, I go around the world defending estrogen and explaining what it does. And the reality is that if you have very low estrogen in your body, you have definite issues in terms of trying to rebuild bone. But there are also, I call them the backdoor ways to try to help. And there are foods that are known as phytoestrogens. Now, it's not quite the same, of course, but it can be helpful. And we have to recognize, and I have to recognize, that everyone all over the universe and all over this country, they're not going to all be put on physiologic doses of estrogen anytime soon, because that isn't the accepted, even though it should be, it's not at this time the accepted way to approach osteoporosis. And it's going to be a steep learning curve to get doctors into understanding the significance of estrogen at every age that women have. But we can try to educate on food, right? So at least if we get people to eat phytoestrogens, like people don't understand soy. They think that soy is evil. But soy can be evil. Like everything has the evil twin. So if you have processed soy, non-GMO, or you actually have rather GMO soy, and you have all these chemicals, pesticides, and all the alteration of soy, then it is evil. But when you have whole soy, the edamame, you have the tofu, the miso, the tempeh, and it's organic, as a phytoestrogen, it works on the beta receptors of estrogen. And there are beta receptors in the bone. There is also alpha. That's why it's not the same as having estrogen, but it's actually helpful. And they've shown, the other thing is that eating plant-based proteins is actually more helpful to maintain bone than eating a lot of animal protein. So we need to have the antioxidants, the polyphenols from plants, and the plant-based proteins. So even in that regard, that's almost never talked about. They just immediately put women on these chemicals that actually freeze bone. So bone is an amazing organ. And it has, like all organs, it's living, right? It's not dead. It's not like if you go to an anatomy laboratory, where you have a skeleton hanging in the corner, and that's obviously not living skeleton, but a lot of people think that's what bone is. But bone is a living dynamic tissue, and it has what we call turnover. So the bone renews itself about every 7 years. That means old bone cells die and they're replaced with new bone cells, and it helps to create not only the protein matrix that keeps bone healthy, but also the mineralization, the calcium structure that people think about. But it's much more. Bone is so complicated. It has protein and it has the mineral component as well. And in order to have a healthy bone, you have to have the old cells die, what we call senescent cells die, often get replaced by healthy cells. And what the drugs do that are used, by and large, they make it so that the old cells, when they die, they don't get gobbled up by the cleanup crew, which are called the osteoclasts. They freeze the osteoclasts so they become dysfunctional. They're part of our immune system so that they can't gobble up and clean up the old dead cells. And instead, they just sit there. And so it looks like you have dense bone, but what you have accumulated over time is very dense in the sense that there's mineral, but the cells are dead. So you have like fragile, calcification of this dead matrix of bone. So it becomes fragile. And that's why they say after you've been on these drugs for a certain period of time, you have a drug holiday. Whenever you hear crazy terms like drug holiday, it means that the drug is harming you, right? And you got to get it off of it, So they use these incredibly ridiculous terms like a holiday from the drug. So it means that the drug is harming you and you better stop it, because you will end up potentially having such fragile bone that you could just walk off a curb and shatter your femur. And as anyone who's been to a dentist knows, dentists won't even touch people with like dental implants if they've been on these drugs, like the bisphosphonates, because they know that the jaw, if they try to drill in it, it could just shatter. So they're not going to like go into that bone. They know it's no good. So it may look dense on the bone density, all our bones, they may look dense, but they're fragile like porcelain. So, in terms of treating bone, we need to think of it totally differently. Living, dynamic tissue that needs to be nurtured, not frozen, so that you have frozen dead bone.
I love that analogy. And when you've been around from the very beginning of the bisphosphonates, when Fosamax just came out, they had no idea of stopping people in 5 years, and it was given to everybody, even people with osteopenia or people who really had, that didn't matter if there was any change in your bone from a 30-year-old, you were put on the medication as prevention. And then, lo and behold, they started seeing these fractures in the femur and other places. So that's when they created these drug holidays. So it's just something to always be aware of, that when something new comes out, it may sound so exciting or it may be presented so exciting, but you really have to be so careful. Every osteoporosis drug, there's another side to it that oftentimes isn't discussed. But this was very sad when they found out, after 5 years, these horrible things are happening. So let's do the drug holiday. And it's
Right. Once you know that bone, the bone turnover time to like completely renew your bone is about 7 years. If you go 5 to 7 years and you basically freeze that turnover, so you're not replacing the dead bone with new bone, then you're going to have almost all your skeleton kind of dead. So that's where they come up. That's where they come up with the 5 to 7 years.
The other thing that's interesting that you touched on was that their bone density, so someone's seeing the doctor, they go on the medication, and then they're like, oh my gosh, your bone density is better. That's so great. And I think this is so interesting because it's a limitation of the DEXA. It doesn't show the quality of bone. It only shows how much bone. So you may have this dead bone that isn't the same healthy tissue, but it will show up, oh great, your bone density's improved. So I think that's really important to bring up.
Yeah. Like another sort of semi-analogy would be if you have a dead tree and it becomes petrified, like a petrified forest, that is not a living forest. So you would have like petrified bones. It's not living bone, it's just petrified. So it's like mineralized, but it's not living. A lot of doctors don't even realize, like what you mentioned, bone quality, that bone is not just calcium, hydroxide. It's not just like this crystallized structure. There's actually living tissue. There's actually a protein matrix. Bone is amazing complex tissue. And the other thing that people don't know, doctors too, is that bone is now recognized as an endocrine organ. It makes a hormone, which is really important, called osteocalcin. And this hormone of bone is very, very important for brain function, cognitive function of the brain, and glucose regulation. So when you lose your bone, you also increase your risk of having cognitive problems as you age, and also having insulin resistance and diabetes. So bone is so complex. It's not just about helping you to walk, which is incredibly critically important, to have a structure of your body that holds everything together. So you have the ability to have mobilization and to do things with your body and your life. But it actually is a key endocrine organ. Everything is more complex than what we ever thought. You know, that's like such an amazing thing, is to really understand the complexity of bone and how critical it is to functioning in our body. And most people don't understand the cells that are called osteoclasts. They're the gobbling up cells. So they're the ones that gobble up old bone to allow the osteoblasts, which are a different type of cell altogether, to lay down new bone matrix that can be then calcified. So the osteoclasts are actually part of our immune system, as I mentioned. They're specialized modified macrophages. They're the immune cells that are designed to put out enzymes to dissolve old dead tissue. Like if you have a wound, an injury, a burn, like you ever wonder, like, how does that dead tissue disappear and then new tissue suddenly appear? How do we heal?
Wow.
So it's these it's like a miracle of nature. These macrophages come and they secrete enzymes that dissolve the old dead tissue. They also dissolve things like invaders, like bacteria. Like our immune system is so amazing. And they dissolve the old dead tissue so that new tissue from growth factors can get laid down. So you build new beautiful tissue and you heal. And of course, old tissue can also just be from dying. You know, our cells die and then new cells from our stem cell supply, you know, replace the old cells. So all of this is happening. And in bone, these specialized macrophages are called osteoclasts. Now, what activates the immune system? Inflammation. So it's actually not recognized that osteoporosis is actually a condition of inflammation of the bone. When you have inflammation, you upregulate the immune system to go into action. And then you're going to actually create more activity of the osteoclast. Why do people get more inflammation in their bone as they age, like through the menopause years? It's because of deficiency of estrogen. Estrogen modulates inflammation. So when you have less estrogen in your body in the menopause years, you're going to have more inflammation everywhere. Everywhere, you name it. And a lot of attention is paid to the vascular system, like in your arteries. You get inflammation in the artery wall, and that can actually lead to atherosclerosis and ruptured plaque and heart attacks and strokes, right? But in the bone, you also get inflammation. And the inflammation in the bone leads to activation of these osteoclasts, which then go a little bit crazy because they're trying to clear up inflammation, and they put out more digesting type enzymes, eat up the tissue. So think about, what can you do as a human female to lower your total body load of inflammation? Well, one thing is to have adequate estrogen. Well, the reality is that no matter what we do with hormone replacement in menopause, we're not going to recreate the ovaries of a 25-year-old. So we're never going to have the same actual environment, because it's not just having estrogen. It's also having progesterone and more testosterone and the beautiful interrelationships and the rhythm of the hormones. So we're not going to recreate, no matter, we're trying, but we're not going to recreate the environment of hormones that you would have if you're a healthy, functioning 25-year-old. So we have to use these other ways. So one of the ways I mentioned is by eating a lot of plants with polyphenols and antioxidants and plant-based protein. So that's all really critical. Another really important thing is to live with your circadian rhythm. So it turns out that bone, like every single structure in our body, is circadian. So what we want to do is make sure we sleep at the right time. We want to make sure that we eat a big breakfast when our body is most attuned to taking in food. We're most receptive and insulin sensitive. So we don't raise our blood sugar as much. We get the glucose into the cells that need it for energy production. So if we eat according to our beautiful natural rhythms, our clock genes, the way we were designed, where we eat a big breakfast, we eat an early dinner, we don't snack during the day, we sleep and get 7 or so, 8 hours of sleep at the right time, like starting around 10 or up to 11 o'clock at night, we go to sleep so that we get our peak melatonin, because melatonin is a potent antioxidant, which lowers inflammation. And we have to nurture our gut microbiome. We now know that there's a link between the health of the microbial population in our gut and the health of our bones, and that when we eat the wrong food at the wrong time, we have an unhealthy gut microbial population, which we call our microbiome, which causes impaired gut barrier function, also known as leaky gut. And toxins are produced in the gut, which leak out into the surrounding tissue where the immune cells reside, creating systemic or overall body inflammation. So what we eat and when we eat and when we sleep and how much we sleep can have a tremendous impact on our bones. And I don't see anyone like in the conventional medical world even addressing any of this with their women patients in menopause or at any stage of life.
You know, Dr. Gersh, I so agree with you, and this is the work I do as well, because, and the good part about this work is that maybe you're doing this or you decide to adopt a more plant-based diet or get all these good nutrients or make sure you're going to bed early and start focusing on your sleep. But when you do all of these things that are major for your bones, what do you see? That you people get so much better. Every part, every aspect of your health increases. And rarely do I see, and you can tell me what you think about this, rarely do I see someone just has an issue with their bones. Usually there's other things going on. And so it's so wonderful that when maybe they sought treatment or maybe they came to see you because of their bones, but then when they start doing all these great things for their bones, everything gets better. Arthritis disappears. There's constipation and their bloating that they've had their whole life is gone. So it's really, I always think of it as a silver lining. You know, you find out that you have osteoporosis. It's not like, oh no, it's like, okay, you know what? What's going on? It's sort of a barometer, like what's going on in your body? Where is there inflammation that you can go to this and you can, you know, it's an area that you can work on, and then your bones get better and everything gets better. So I love that you brought all this up. I just have to say something funny, because I know in the Ayurvedic world, and they always say the hours between 10 and 12 are, it's like, you know, are more important than the hours beyond 12 in terms of the sleep. And I decided I'm going to try this. And I used to go to bed maybe 11:30. And so I started going to bed at 10. And oh my goodness, it was life-changing. I can't even get over. And I've been doing this now for probably like 10 years, but it's amazing. And when people just start doing that and getting their circadian rhythm, it's just wonderful. So thank you for bringing that up. But let's go a little further. Continue. I'm sorry.
No, I was just going to chime in and agree that the body sinks or swims together. You don't have like one organ system that's in trouble as you age and all the rest are pristine. That's why it's always shocking to me when I see articles that say, we just discovered this amazing thing. When women have osteoporosis, they're actually also more likely to develop heart disease or dementia. Of course, because you have systemic inflammation, every organ is suffering. Every organ is nutrient deficient. Every organ is inflamed. I mean, of course, that's why when you eat for your bones, you're eating for your heart, you're eating for your brain. So that's why you don't have to like learn that, oh my gosh, if it's good for your bone, it might be bad for your skin or for your brain. So that's the beauty of it, that we are one whole. And when we lift up one organ system, we're lifting up all the others.
I think that's the win-win of this situation. And that's why there's so much we can do. And I love that you bring this whole integrative medicine approach to the work you do and just see things a little differently. And I really believe, because I'm surrounded by physicians and I work with conventional doctors all the time. And it's not that they mean to ignore something. I just think it's not part of the medical training. And I think that, you know, they learn about osteoporosis and that this is what you do. So I don't think they're trying to ignore important pieces. I just think it's something that's not, do you agree with me with that? It's just not in the training program?
Yeah, well, it's definitely not in the training. As you know, big pharma has tremendous influence on medical schools in terms of research monies. It used to be that they gave a lot of individual funds to individual doctors, but now they don't do much of that, but they give tremendous amounts of money to the medical schools themselves to then use in various ways for research and so on. They're in bed together. I mean, it just is what it is. So most of medical education is focused around medical devices, surgical techniques, and pharmaceutical treatments. And lifestyle and what I would call the foundation of life itself is ignored. And like they're not taught. And I have students rotating through my office all the time. I try to educate the new generation. Sometimes
Good for you.
I'm like a shock and awe. It's like, wow, because they don't get taught this. And so I do know what's being taught still, and not much has changed. There's a little bit of talk about we're going to teach more about nutrition, but not much. And it's really, it hasn't changed much in 30 years. It's still, I mean, drugs have changed, surgical techniques and devices have changed, but the underlying foundational philosophy has not changed. And now that something like 70-80% of doctors are employed by big healthcare entities like Kaiser and other HMOs and hospital systems, in general, they're committees and they create policies and procedures and they expect doctors to follow it. So, and this is a generalization, but often doctors are a little or more than a little discouraged to be sort of creative and innovative. It's like, what are you talking about? That's that's not on our formulary. You can't do that. That's not allowed, So creative thinking, what used to be considered like the spark of humanity, being innovative, creative, observational, like this is what I'm seeing. That's discouraged now. If it's not a double-blind placebo-controlled study that's formulated by a big pharmaceutical company, it's usually like trashed. It's like, no, that doesn't count. Like you only, that's a case study, or that was like 10 people because like there's no funding, or, so it's like it doesn't count. So actually observing what's happening among your own patients, that doesn't count because that's not considered valid anymore. That's low scientific evidence. And being creative and going off the beaten path, oh my gosh, that's not standard of care. You'll be punished. So it's really hard for doctors, MDs and DOs to actually use time with patients to do more than, they don't have much time either. They have very small amounts of time. They're spending all of it on the computer systems. You probably have heard the electronic medical record system has become like a firewall between patients and doctors, and the poor doctors are typing all day long, and they have so many boxes they have to fill in and they have to do, or they're not meeting the requirements of their medical group or Medicare or something, So it's a real challenge. So one of the things I'm trying to do is help to change the system, because doctors now have very high rates of what they call burnout. And it's because they know they're not really effectively changing the lives of their patients. It's like, how many drugs can I prescribe for you today? And when you probably have seen this, the statistics on the number of pharmaceuticals that people over 65 are on, it's like shocking. I don't want to make up a number, but the last time I looked, it was such a high number. It was like 10 or something. Like, how are people staying on all these drugs? And there's so many interactions. So, I'm hoping little by little to try to make a change. But, we all do our own thing. We try to work with our patients. We try to educate, like on these forums, to try to help people to also take charge of their own lives, to recognize that they do have power to choose what they eat, when they sleep, and also what doctor they go to see.
I think that's so important, and that's such a good point, and that's why I did the podcast. Honestly, that was the whole reason, because I was really frustrated as a physical therapist and integrative health coach that I'm working with people and I saw what the conventional treatment was, and I know there's a better way. And I also knew that it was bigger than me. I'm one individual, and yes, I help with food and exercise and lifestyle, but it's much bigger than me. And that's why I wanted people like you, Dr. Gersh, to come on and educate, because people need to know that there are things that are working and people are getting better, and there is another way, because people don't want to go on the medication. That's what's changing. I think there's two things that are changing. I do think that more and more doctors are learning about integrative medicine and getting more involved. I really do see that there are people that are interested, and once they have an issue, I see a lot of the doctors who have gotten into holistic and integrative medicine had a problem themselves that they couldn't treat with conventional medicine, and that opened their minds that maybe there's something else. So I do see that is increasing, and people are being trained in these programs. So I think that's a good thing, and I think people are asking questions, and people are not just relying, oh, well, the doctor said I'm going to go on medicine, I'm going on medicine. Usually they do a Google search, and not that they always get the right information, but people are starting to really take control of their health. And so I think there are reasons that things are improving. And I think when people do get better and their bones get better and things start improving, and I see this all the time, people's bone density, even though it can get better without the medication. And then, so that's, I think, the good thing, but people are getting better as well. So I do think I'm also the world's biggest optimist, but I think we have reason to be optimistic. So that's I think we just have to keep doing our work.
Absolutely. And I think part of, statistically, it's still a small percentage of doctors, but it's a rising percentage of the population. So I like to think of a lot of things as consumer driven. And when the population, the patients, start demanding something, there will be their demand will be felt. There will be a creation of a new group of doctors and escalation of holistic and integrative care, because the demands of the patients will have to be met, because people won't put up with it. So that's why it's so great to always take charge, right? Be in charge of your own life, your health. And I'm so glad you mentioned the physical exercise, because we hadn't even touched on that. And the connection between bone and muscle, of course, is enormous. If you have even like weak bones, but you have, this doesn't usually happen, but you have like weak bones and great muscle, usually they kind of go as a team, like they're good together or they're bad together. But if you can maintain, even if you don't have optimal bone, you may never have a fracture if you maintain flexibility and balance. And of course, you think about tripping hazards, and you have proper lighting, and you're careful when you like run across a room, like you think about what you're doing. So you are mindful of what you're doing when you're doing stuff, then you will not break a hip. People don't, unless they've been on a bisphosphonate for years, they don't spontaneously, which can happen, but otherwise they don't spontaneously break their hip, which can be a very high cause of mortality and an incredible cause of morbidity. So after a woman, which is not always a woman, but 80% of the time it's a woman, breaks a hip, their life is never the same. So even when they don't die, a very high percentage will actually have limited mobility, fear, pain, and they'll go into a state of catabolism because they're immobilized while their bone is healing. They lose a lot of lean body mass, and they can never actually recover all of that, even with great diet and so on. It's at a certain point in life, it's like muscle is precious. It is so precious. So we have to do everything to prevent that fracture. And depending on the age of the woman, there is a correlation with mortality. Obviously, the older a woman is, the higher the mortality rate. But it's not insignificant at any age when a woman has an osteoporotic hip fracture. And that's a terrible thing. And almost everyone knows of a friend, a relative of a friend who has died as a consequence of a fracture. And it's not always on the death certificate, by the way, because the death may be due to sepsis or pneumonia that happened because they developed a pressure sore because they were not moving around, or they developed pneumonia because they were so, they weren't breathing deeply and they weren't mobilizing, or they developed malnutrition because they became constipated and they just didn't have any appetite anymore. So there's many ways that you can have secondary, tertiary, developments that can lead down this path that can cause someone to die at a premature age. And so we want to do everything to maintain muscle. And so fitness is a vital sign. In fact, if you're in the bottom fifth of what we call fitness, you know, and it's like, it looks at your strength, your flexibility, your mobility, and everything. So you know all of that the best. If you're in the very bottom of the range for fitness, you have a higher mortality than if you have serious hypertension. So fitness is a vital sign. In my practice, I have a fitness specialist in my practice.
Fabulous.
We have a high-end body composition. We check body composition. We want to know. And we do the fitness test that was developed through the combination, the joint efforts of the American College of Sports Medicine along with the American Medical Association. And they developed a fitness test that doctors can implement, or they have to work with a fitness specialist outside of their office if they don't have one like I have in my office, and that you can actually measure officially, but every year, the fitness status of your patients. That's just as important as measuring their blood pressure. That's why, like, a huge take-home message for everyone to know that even if you can't have a fitness specialist in a gym like I have in my office and all this, you can find someone in your community that you can work with to actually get tested, so that you know you cannot monitor what you never measure. So, I mean, I applaud everyone who's into physical therapy and nutrition. All of this comes together to maintain the healthy body that we all must have if we're going to have what we call healthy longevity. If you end up in a wheelchair because you can't walk and you're in chronic pain, that you may still be alive, but you don't have quality of life. And, you know, we really emphasize quality of life, not just number of years.
Right, and that's absolutely what we want. And we've had some really great people on in terms of because I believe you have to love your exercise, and there's so many ways to achieve it. So whether, you know, we've talked about strength training, we've had people on Pilates and yoga and what's safe, and there's just so many, but I totally agree with you. And that's great that you have that in your office. What a wonderful thing. What a great addition to your practice. That's really wonderful. A couple things, because we can talk for so many hours, but there's a couple things that you talk about I just wanted to bring up, because a lot of people think obesity, and if they're heavy, then they don't have to worry. I think this is a topic I know you talk about, because a lot of people think, oh, I have more weight in the bones respond to the forces placed upon it. No problem, I'm heavy. The good thing is I don't have to worry about my bones. But that's not true. So why don't you just enlighten us to that a little bit?
Okay, so once you understand that osteoporosis is due to overactivity of these specialized immune cells called osteoclasts, then it becomes easy to understand why obesity is not the protection we once thought. Because when people have obesity, and by obesity now we're talking about the visceral fat, the belly fat, the fats, that type of fat is not the healthy fat, not the structural fat. This is exogenous, like created fat from bad diets, and it becomes endogenous into our body. So this type of fat is highly inflammatory, and it gets infiltrated by the immune cells and creates a lot of inflammatory cytokines. So people who have all of this visceral fat and belly fat, they are highly inflamed people. And this inflammation is everywhere. So we now know that obesity is associated with everything, right? Cardiovascular disease, dementia, of course, insulin resistance and diabetes, and osteoporosis. We didn't understand. We thought, oh, well, because you're carrying all this weight around, it protects your bones. No, not when you're living in an inflammatory environment. If you're carrying more weight, but it's healthy muscle, and that's the extra weight that you have. So you do a body composition and you are like, oh my God, look at those muscles. You just, that it's not inflammatory fat. It's really healthy, lean body mass that you're carrying. And that's what's giving you the extra weight. Then you're in good shape. That's a totally different scenario. That is not the typical, obviously obese person. When you look at their body composition, they have high amounts of visceral fat, inflammatory fat. So being overweight is not protective. Now, being frail, being super thin is not protective. And in fact, what they have found for women in menopause, they tend to go in one of two directions. And this doesn't sound pretty. It just is what it is. You get the group that becomes fat, and they have visceral fat because estrogen helps modulate energy production. Without adequate estrogen, you tend to accumulate visceral fat. Okay, and you tend to have more stress and sleep problems, and those all lead down towards the path of insulin resistance, which leads to, poor utilization of glucose and more fat production, fatty liver. So that's a whole complex thing. But the end result is that women after menopause often lose their cute little waistlines. And I have patients all the time. They say, my body is morphing. I'm getting muffin top. I have a belly. I never had this before, and I'm not doing anything differently. It's because estrogen is no longer there to control all of these functions. The other side is that they go towards getting very thin, and they actually are what we call the skinny fat. But if you actually did a body composition, they look very lean, but they actually have percentage-wise too much belly fat, even though they're thin. And they actually are inflamed. And it's actually a high risk to be very thin and have have very low amounts of muscle and very low lean body mass, but you have all that visceral fat that's like hiding in there that's creating inflammation. So very thin women and very overweight women, obese women, all have too much inflammation, which leads down the path of osteoporosis. And the other thing I just have to touch on, no matter what, is the issue of birth control pills. You're going to bring that up too, because it's not well recognized, but there are published reports, published studies that you need to have this beautiful rhythm of hormones during the reproductive years, the bone growing years, which are like from puberty into the very early 30s. Those are the years, and the peak bone growing years are the late teens into the middle, up to the middle 20s. Those are the peak bone growing years. Those are also the peak years that women are put on birth control pills and what I call similars, other pretend hormone contraceptives, implantables, IUDs, and so on, that alter the beautiful natural levels, production, and rhythms of women's hormones. So women who are on those kinds of contraceptives will develop a less peak bone density. And we don't know how to really fix that, like when you're in your 40s and 50s and beyond. So I urge women to understand the critical importance of having a healthy musculoskeletal system, because this impacts muscle development as well. The role of our hormones, testosterone is reduced when circulating free testosterone is reduced by birth control pills. Progesterone and estradiol from the ovary ceases to be produced altogether. And the chemicals in birth control pills are officially listed on the U.S. toxicology website of the National Institutes of Health as endocrine disruptors, chemicals like what you'd find in plastics, only these are called pharmaceuticals. And they call them hormones, but it's no different than if you call licking plastic getting your hormone dose. They're chemicals that interfere in a whole variety of ways with actually our own natural hormones. And this impacts on the development of the musculoskeletal system, which includes ligaments and tendons, muscle, and bone. So, I'm not in favor of unwanted children and pregnancies that people are not planning for, but we have to be aware that when you interfere with reproductive functions, you're interfering with musculoskeletal development to be optimized. Of course, you have musculoskeletal development, but it's not optimized. And this can, like you mentioned at the very beginning, when you reduce just by a tiny bit your peak bone mass, that can have tremendous impacts later in life. And this is what's happening. And I fear that the generation of women who spent the bulk of their reproductive years, and this is rampant, the bulk of their reproductive years not having real hormones, not being on these contraceptives with pretend hormones, that they're going to have higher rates of osteoporosis than we've ever seen in the past, especially when you add in the sedentary lifestyles, the nutritional quality that is lacking and so on, and the lack of sleep, circadian rhythm dysfunction, all these things that are part of modern society. We are in for a big shock of problems. And I'm seeing this in terms of young women not having fractures at a young age, but having damages to their joints from doing next to nothing. Like they were put on birth control pills when they were 15 because they had menstrual cramps, which is another whole thing. It means that there's something wrong with you. Usually you have magnesium deficiency when you're having all those menstrual cramps when you're 15. And you need magnesium, of course, for bone as well. So you end up, getting these young women put on birth control pills at age 14. And then when they're like 29 or 30, and they're planning on having kids when they're like 34, this is what's the new norm. And so they're on birth control pills through all the peak bone growing years, but they're also the peak development years for the ligaments and tendons as well. So they go to a Zumba class and they're just dancing and they're just going like this, and they tear things in their shoulders. Like they're tearing, the cartilage off, they're tearing the ligaments and so on in their shoulder just from doing stuff that should never have an impact in a young woman. And so we're really, I'm already seeing the effects of this in terms of joint health. And people don't realize that joints are part of the bone health, that that when you have the cartilage covering, like in the knee, the meniscus is the cartilage that covers the bone so that you don't have bone on bone. You've all heard bone on bone, right? So it's the coverage. The meniscus is the cover of the bones to keep them from hitting each other. And they rely on a healthy bone to connect to. When you have poor bone, then you have the meniscus start to peel off. And they say, oh, you tore your meniscus. It didn't tear. It just starts fraying because it's unhealthy, because you don't have proper nutrition and you didn't have a healthy meniscus to develop in the first place, and the bone that it's attached to is not healthy, so the bone is disappearing, and so the meniscus is separating off, and that's why doing knee surgery in people over 50 is almost always futile and accelerates new knee replacements and so on. But a lot of people don't realize how critical bone is to joint health, and I'm seeing young women already having all kinds of joint issues at crazy young ages because they were on contraceptives involving these, pseudo hormones from incredibly young ages. So I just had to put out that warning that, think condoms. I wish I had the secret contraceptives that was amazing and didn't interfere. But once like we talked about, everything is one body. Reproductive function and hormones are linked to metabolic function, bone function, brain function. It's one interlinked body. You can't poison one section of the body and have everything else humming along. Everything is going to be injured in some fashion.
Wow. Thank you so much. I mean, this is what you see. And again, we could talk forever. I hate to end this, but I do want to tell everyone about a few things. I could talk to you for really 8 more hours straight, and we probably wouldn't touch everything that we want to say. So before we end, but that's important because that's what you see. I mean, just a quick question about that, and then I have a couple other things I wanted to just quickly ask before we end. So if women have been on this, when do you recommend they get tested for osteoporosis?
Well, the standard is at age 65.
I know.
But I think that especially if it's going to motivate women, that as soon as they hit menopause, they should get one. And I'll tell you what happens when they hit menopause. Then they look and they find out that they have what would be called severe osteopenia. That doesn't mean they lost their bone. What that means is they never built their bone because they didn't just suddenly lose it all. So I liken it to you hit retirement and then you look at your bank account and you find there is nothing in it. There's $5. It doesn't mean you just spent all your money and you spent your life savings in the last year. What if you never saved? So you didn't put money into savings. So when you hit retirement, there's nothing there. If you don't build up your bone for what I'll call the menopausal retirement bone years, right? If you don't have enough bone to sort of keep you going and you start off menopause with already very osteoporotic or osteopenic bones, and I've even seen osteoporosis in, obviously women who've had anorexia, they have even worse bones, and then they usually take them and put them on birth control pills, and they just never build proper bones, so they will often be categorized as osteoporotic, and they're young, and so of course when they hit menopause they don't suddenly get better bone. So, but I think it's good to know, it's like taking an assessment of what you've accomplished through your life in terms of your bone retirement account. and a lot of women are really shocked when they find, it's painful to say the least, that they find that their bone is not good. when they're like 50, and it's already not good. And it's not good because they lost it. It's not good because they didn't build it. And, maybe we should think of doing bone densities earlier, but a lot of the times there's not even good data on it. Like we don't even have like really good statistics to even say what that means. But certainly if you get one around age 50, that will give you sort of a marker for where you are for the future and, what you've accomplished in your lifetime.
Right. And the good news, though, is that when you see the right people, there's so much you can do that you don't have to end up one of the statistics that we talked about early on. So on that note, a couple things I wanted to just say, because I guess I said there's so much to talk about. I love talking to you. There's so much interest. So I just want to say something about you that beforehand that you wrote, besides the osteoporosis, and I think maybe one of the reasons you are so into all of this with building bone when you're young is that you've done a tremendous amount of work with PCOS and fertility. Mm-hmm. And I just have to do a shout out because I love, you have a new book, and for those who are seeing this on video, it's called it's really a cute, I love the, it's very cute, the cover, but it's PCOS Fertility Fast Track, and it's the 12-week plan to optimize your span. And I just love it because it's really clear cut. You tell them exactly what to do, and it just gives a step-by-step guide. So I just think if you know anybody with PCOS, and we're going to have the links, this is just an amazing book. And I really think it's great because you do give what to do. It's not just, and then your other book is a whole huge book on PCOS, and it's on PCOS SOS, like how to deal with this naturally. And you give so much information. So if you know anybody with PCOS or you have PCOS, phenomenal resources, and I'll have them in the show notes. But my other question to you is, because again, we could talk for so long, but how do people find out more about what you do, and how do they get in touch with you? And just give us a little bit about how people could even, I know people can even work with you even if they don't live in California. So why don't you just fill us in a little bit about that?
Right. So I have a medical practice. It's called the Integrative Medical Group of Irvine, and Irvine is in Orange County, Southern California. In
Lucky
fact,
you.
You're in one of my exam rooms, and I'm working most every day that I'm not, speaking somewhere, doing a lecture somewhere. But otherwise, I am here in my office seeing patients. So I do have patients that do travel from all over the country, even the world, to come and see me. And so I love to see people in person. For people who can't make the journey, I can talk to them with telemedicine. If they're in another state other than California, I have a restriction, unfortunately, because we have a state system of medical licensure. As MD, or I'm an MD, we're licensed in a state. So I'm not allowed to prescribe or order tests on someone who I've never seen that's living in another state. In California, because if someone's living in California, I can do anything remotely. I can order things, I can order tests, I can even prescribe, I can do anything if they're in California. For another state, I can give information, I can give advice, but I can't be ordering things, I can't prescribe, I can't do that because I'm a California doctor. But we can still, I help set up plans for them. People who live in another state, I can give them advice. I can help them to work with their own doctors or even with their doctors so that they can get the test. Sometimes I make a list of these are the things that your local doctor should order for you. So I'm sort of like, we work in a surrogacy kind of a manner.
Okay, but you know what? People get that. That's the thing. If you're feeling, oh my gosh, I don't know where to go. I don't want to go on the medicine. I don't really have a doctor that I feel comfortable with. That's great. Then they can see you as a consult, or that they could work with their regular doctor. So that's really huge.
I would love for everyone, and you'll put it in your show notes. You mentioned to follow me on Instagram, and I'm planning on putting out more videos and things on Instagram. And so I can always use more followers, because otherwise I feel like I'm working and nobody noticed. So that would be great. And people can go to my website, and I will soon have a new opt-in on my website that if you want to give me your email address, this is how it works, then I give you a free ebook, and it's going to be all about nutrition and heart health in women. So it's actually a really nice ebook. I'm just putting the finishing touches on it. that everyone who will come to my website will get a present.
Oh, fantastic. Well, this is just so great because you are a wealth of knowledge, and it's taken, we've known each other for several years now, and I always love seeing you every summer, which is so much fun at the meeting. And we've been talking about coming on, and your schedule's busy, and yay, we finally did it. I'm so excited because you really gave everyone so much information, and I
did it.
And I can't thank you
for having me.
Oh, this has been absolutely my pleasure. You can come on every day if you want. I just, we're so much on the same wavelength in the way that we're helping people, and you're just doing it in such a big way. And the fact that you're training new students, it's all just so good and so helpful for the world. And thank you so much. And thank you for being here. And I look forward to keeping in touch.
Same. Have a wonderful day, you and everyone out there.
Yes, everyone. Bye, everybody. Bye.
I hope you've enjoyed today's interview with Dr. Gersh as much as I have, and have learned some new information that you can apply to your life. I know I could have spent 8 hours more talking with her because she's just a wealth of information. All the links we talked about will be in the show notes. And the good thing is that Dr. Gersh truly wants to educate people on health as much as she can. So I'll have the links to her Instagram as well as her website. And she is willing to help people one-on-one. So if this resonated with you, do follow up and connect with her. So goodbye for now, and I look forward to seeing you next time. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.